Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Wednesday, June 17th, and this is my daily briefing. Today I'm going to update you with current case counts, including new active cases in Missoula County, and I'll revisit Missoula County's approach to reopening with things that we need to consider moving forward. Today we have 2 new positive cases in Missoula County. These 2 cases are currently under investigation. The cases and known contacts are in quarantine and isolation and will continue being monitored and supported by medical staff as needed. This means that to date we've had a total of 46 cumulative positive COVID-19 cases in Missoula County. 44 of those were identified by testing and 2 were epi-linked. We've had 40 recoveries and 1 death, and we have 5 active cases currently. The state of Montana is reporting a total of 630 cases, including 18 new cases confirmed this morning. In addition to our new cases in Missoula County, new cases today are being reported in Custer, Gallatin, Bighorn, Flathead, Carbon, Cascade, and Ravalli counties. So we're definitely starting to see an uptick in cases statewide. The state is reporting 72 active cases across Montana, and we also learned of another COVID-related death this morning, making for 20 deaths statewide. Our condolences go out to the family, friends, and loved ones that have been affected by this loss. Today, I'd like to revisit our reopening criteria. While all U.S. states are now reopening, each state is taking a different approach to it. Each state is on a different timeline, easing different restrictions in a way that local leadership sees fit. We're seeing the same thing in Montana, where the governor announced the start of where the governor announces the start of a phase, provides the general guidance, and then allows local authorities the ability to assess local level needs and develop and implement a response plan specific to their community. There are 3 broad considerations for reopening Missoula County. These things include timing, continuous assessment, and a phased approach. So first, let's talk about timing. The stay-at-home directive and social distancing measures were effective when they were in place. They kept our case counts relatively low and therefore manageable for our healthcare infrastructure, which includes the facilities, staffing, and also contact tracing. While things are reopening, that does not mean that COVID-19 is gone. We're seeing evidence of this as case counts increase across the state. Just this week, Missoula County has had 5 new active cases after not having any cases for more than 4 weeks. Reopening requires coordination and cooperation. We make directives and provide guidance based upon epidemiology and local needs, and we ask that community members abide by those directives and respect the guidance that promotes public safety. Continuous assessment is just that. It's continuous. We're monitoring a variety of factors, seeing how they change across time, and determining if, when, and how we need to pivot or shift our response efforts in order to respond to those changes in real time. We're seeing other Montana counties taking the same approach. With continuous assessment, they're able to respond quickly and effectively when they're seeing case counts increase. In some counties, we're seeing a return to some more conservative guidance, which is a response to managing the increase in cases. Reopening is a gradual process, and it really needs to be. This allows our response to directly address the current needs. When we dig a little bit deeper into timing, continuous reassessment, and a phased approach, we can see more specific factors that we're monitoring. Some of these more specific factors include our epidemiological trends, the supply chain for our needs for testing, healthcare infrastructure, and our contact tracing capacity. When we look at epi trends, the things that we're asking are, what does COVID-19 look like locally, as well as in our neighboring counties and states? Right now, we're seeing cases increase across the state and across the country, particularly in places that maybe did not allow for more time to assess what safely reopening looks like for them. We look at what does viral transmission look like locally, as well as in our neighboring counties and states. We will respond differently to travel-related, close contact, and community spread transmission types. Right now, we're seeing all transmission types across the state and here in Missoula County. This means that our response needs to continue to be really comprehensive. We also ask, is COVID-19 continuing to shift from cities to rural America? Right now, evidence indicates that this has been and will continue being a trend, with rural communities now receiving more COVID-19 cases. So now on to looking at the supply chain. When we're looking at the supply chain, we have to ask, do we have the test kits, including the test itself, viral media, transport supplies, lab supplies, and so on? Much like the rest of the country, Missoula County has historically had limited supplies, meaning that we have had to continually evaluate our needs and our resources and prioritize testing appropriately. We have received some additional funding due to our designation as a high visitation community. This means that we are receiving some additional resources so that we can broaden our testing and shoring up our healthcare infrastructure. While this additional funding is very welcome, it is enough to allow for slowly broadening our testing criteria. Within the next 2 weeks, we will start seeing some sentinel testing, which is the strategic testing of asymptomatic individuals who are working in high-risk environments like frontline healthcare workers, first responders, grocery store staff, and that's just to name a few. This will better inform our understanding of COVID in our local community while addressing the health needs of those that are most affected right now. Next, we look at our healthcare infrastructure capacity. We have to ask, do we have enough medical staffing across the county to address current and anticipated healthcare needs? Remember that Missoula County serves more than just one county alone. We're a healthcare hub for our neighboring counties and some neighboring states too. We need to be able to continue to serve those populations that we have always served while also addressing the need to serve people who might be diagnosed with coronavirus. We also ask, what does the current staff capacity look like? These folks that have been tirelessly working since mid-March to address the epidemic. We must constantly look at sustainability of our entire response, which includes our expert specialist ability to successfully continue addressing COVID-19 without burning out. One more consideration at our county health department level is our contact tracing ability. While this is part of our healthcare infrastructure, it's important to discuss it on its own as it's absolutely critical to managing COVID-19. So contact tracing refers to public health's ability to investigate a positive case, identify all of their close contacts, evaluate the risk of exposure to those contacts, privately and confidentially connect with those contacts, provide them with relevant information and guidance that they need, as well as continuously monitor those close contacts if evidence shows that they are at a high risk of being exposed to the virus. I share all of these steps because a lot of components of COVID-19 and our response to it, contact tracing is a broad term that encompasses a myriad of integrated and complex factors. So, I know that is a lot of information. It's important to step back and hit the pause button every so often. We're seeing new cases across the state each day. Some counties are getting hit for the first time, while others have been at a plateau and they're now starting to see a rise. As we continue moving forward, I just ask for your continued patience as we monitor and evaluate COVID-19 in our communities and develop and implement guidance helping to diminish or slow the resurgence of the virus. Again, this effort is a community-wide effort. It really requires coordination and participation from public health and safety to the public at large. We ask that you continue practicing those safe behaviors. I know everyone is getting sick of hearing it, but it is really important that we respect one another and respect the health and safety. So please wear cloth face coverings whenever you are out in public. Keep that 6 feet of distance between you and others as much as possible. Wash your hands thoroughly and frequently. Try to keep your social circles small, which will help keep contact tracing at a manageable level without overwhelming our healthcare infrastructure. To this end, we are also looking for help supporting our COVID-19 response efforts. We shared on Facebook last week a variety of job positions that are open here at the health department, and we're going to share this information again. We're looking for nurses, call center staff, and other assistants. So stay tuned for more specifics, and definitely check out our Missoula County website for that employment information. So until tomorrow, everybody, stay healthy and be well. As always, you can subscribe to me on YouTube under my name, Cindy Farr, CindyFarr. Click the notification bell so that you get notified when additional videos are uploaded. Follow us on Facebook. There will definitely be some employment information on there. You can also check out the Missoula County Employment website. Check out our other website at missoula.co/cvirus for information specific to COVID-19. And call 258-INFO if you would like to schedule an appointment to get tested. If you're having even mild symptoms of COVID-19, you can get a test that way. You can also call that number if you just have general questions about COVID-19 or our response or need some guidance. So until tomorrow, everybody stay healthy. Thank you.